Welcome, everyone, and thanks so much for joining us. Getting us started today is Joel Myers, so I'm going to welcome Joel.
Welcome, everybody. I'm Joel Myers, Director of Communications here at Global Washington, and I'm proud to introduce our fast pitch session. You'll be hearing from 4 organizations. Each will have 2 minutes to wow you. After the presentations are complete, we encourage you to learn more about these organizations and follow up with the speakers in Whova. You can do this using the Whova community option, look for the fast pitch interest board, or message a speaker directly. We will also be posting a People's Choice poll in Whova so you can vote on your favorite. The winner will be announced at the end of today and will win a free ticket to next year's Goalmakers conference. All right, let's get started.
Close your eyes. I want you to picture your most powerful partner, the one person who will help you the most to achieve your mission. Who is it? Is it a funder? Is it someone who sits in Seattle? Or is it somebody halfway around the world? My name is Tim Prewitt. I'm the president and CEO of the Hunger Project. At the Hunger Project, our most powerful partners are those living with chronic hunger across Africa, Asia, and Latin America. It's been this way since our founding 44 years ago. We knew solutions designed by and for those living in poverty are the ones that last. This practice, called community-led development, is by nature anti-colonial. Now, we do some things well, like elevating local leaders. Our global staff members, along with our community partners, defined our shared future recently through a strategic planning process. But we have much more work to do. We need to ensure those closest to the communities drive funding and programming decisions. What have we learned? We've learned that decolonizing development starts within each of us, examining our mindsets and shifting them. It's hard work and at times uncomfortable, and it's absolutely critical. I'd love to talk more and tell you how we convene 1,500 community-based organizations as part of a global movement. Stop by our booth or reach out for a conversation. To truly end hunger, we must all shift the power to local leaders so they can build lives of dignity and self-reliance.
Thank you, Global Washington. This is Dash from India. Hello, good morning, everyone. This is Dash from India, speaking for Sukarya. Sukarya, these 2 Sanskrit words together mean noble deeds. Long before United Nations started its Millennium Development Goals, Sukarya had already started working with a holistic approach to address all major issues of women living in the urban slums and hard-to-reach villages in Delhi, Rajasthan, and Haryana of northern India. The objective of the Education on Wheels and the Gender Equality Program was to provide healthcare and nutrition to women and children, education to non-school-going slum children, and make every adolescent girls realize they are equal to boys and have equal rights to healthcare and nutrition, while having their own voice to speak for themselves. To make its intervention sustainable, Sukarya, and to support the community-led decentralized development, Sukarya works very closely with all religious and senior community leaders, women and men at the very grassroots level. What is the situation right now? It is very serious. We are in a crisis. More than 50% of women and children are anemic today. 37% of the children under 5 are stunted. 20% of them are wasted. We got to do a lot of things. We look up to philanthropic organizations, individuals, corporations for support to build our capacity so that we can reach out to bigger communities. Please join us, support us. Thank you. God bless you.
Oh, hello, I'm Karl Weyrauch, family doctor and founder of Pygmy Survival Alliance. We work with the indigenous people of Rwanda. According to history, they are known as Batwa Pygmies. Because of population crowding and guerrilla conservation, they lost their ancestral lands and struggled to survive. For many years, they've been fighting systemic discrimination and health inequities. When we met in 2008, they were barred from entry to shops and schools. Over half their children died before age 5. For the past decade, Pygmy Survival Alliance has supported the struggle of hundreds of Batwa families. We partner with local leaders to find solutions at minimal cost for maximal impact. After 78 truly collaborative projects, the villagers have achieved greatly: improved sanitation and hygiene, food and water security, jobs and access to healthcare and education. Now, their children don't just attend school, some are at the top of their class. They've broken barriers and earned respect. With children surviving, moms asked for help to build a preschool. Next, we're building an institute where Batwa people can train others in community empowerment. Yes, community empowerment is what decolonizing global development means to us, and we've been recognized for our efforts. Yet hundreds of Batwa communities still need support. Please join this effort. Let's talk. Thank you. And thank you, Global Washington.
VillageReach is a global health innovator that develops, tests, implements, and scales new solutions to critical health system challenges in low resource environments. We transform healthcare delivery to reach everyone. Just as important as what we do is how we do it. Given we work predominantly in Africa, we would be remiss not to acknowledge the continued impact on the work we do today. VillageReach is committed to making actionable change to decolonize global health. Some examples of what we're doing include hiring in Africa whenever possible. The last year and a half, 75% of our new hires have been non-expat, local African hires. We've included diversity, equity, and inclusion targets in our 2021 to 2023 organizational objectives. And we offer quarterly personal learning and development sessions for staff on systemic racism and colonialism. I'm Julia Guerette, a manager on our data analytics team and the lead of our diversity and inclusion personal learning and development group. Before starting my global health career, I did a year of service with AmeriCorps. And to ensure we met our service requirements, my team lead assigned each of us an accountability buddy. And while I know that might sound silly, it worked, because without accountability, there's no responsibility. VillageReach knows that not only can we continue to do better, but that the work truly needed to decolonize the sector extends beyond just us. It extends to all of you here today. So this is our call to action for Global Washington members to join VillageReach in our newest commitment to dismantle and rebuild the system international development was built upon. Collaborate with us to form a coalition of organizations who can be each other's accountability buddies. Together, we will create a tool with sector-specific indicators that we as organizations will use to monitor our efforts to decolonize our work. We'll establish processes to publicly and transparently share out the results of our internal assessments, and then develop meaningful solutions to address problematic areas we've identified. Systemic plague requires systemic remedy. So let's hold each other accountable to making systemic change. If interested in joining us, email dei@villagereach.org.
Wow, that was amazing. I have chills. All right, we got to close this up really quick. You can look in, let's see, the fast pitch board and look for the poll that should be pasted to you in the chat. All right, thank you all very much. And thank you, presenters. You guys were incredible.